So today I want to talk about the status of COVID vaccination in the United States, um, and getting this uh, vaccine administration going, getting the vaccine into the arms of the people. Uh, we were supposed to have 20 million doses delivered by the end of 2020, and it's only been 2.5, 3 million doses tops. And, you know, this is a story that repeats itself over and over again. The government makes all these rules and regulations, and then they come back and complain that, for example, as a pediatrician, say, well, how come you didn't vaccinate the kids? And they had all these rules preventing me from doing just that. Like in my office, I have two refrigerators, and I have a kid who needs a vaccine. And if he's got one insurance plan, I got to get it out of refrigerator A. And if he's got another, refrigerator B. And if I'm out of one stock, I can't trade them out. And so I've got doses sitting there I can't give. I got people waiting to get it. They can't get it. And this is nothing new. So anyway, getting back to COVID vaccine. I have yet to get the vaccine delivered to my office. It's being the government, federal government's giving it to the states, and each state's trying to figure out how they're going to deliver it. Now, it makes sense that the hospitals are getting it first to deliver it to their first line workers who are caring directly for COVID patients, and it to go to nursing homes, etc. But look, the doses aren't being given fast enough. And we've got a whole nation full of healthcare providers like me who are ready to start administering it, and we don't have it. We can't administer it if we don't get the vaccine. And as of yet, I have no way of getting this vaccine. I'm waiting to hear from the state to say, okay, we've got it for you. Tell me how many you want, and we'll deliver it. Now I know there's a national shortage, okay, but the bottleneck right here isn't so much the shortage of vaccine; it's the failure to administer it, the vaccine that we have. So again, I can't give it until I get the vaccine, in my office. So that's the first thing. And if it's my office, then multiply that over all the other pediatricians, all the other family practitioners, internists, etc., health clinics. We don't get the vaccine, we can't give it. All right, that's the first thing. Second thing is removing some of the unnecessary red tape. I mean, you got to go through all sorts of hoops to even be an eligible vaccinator for COVID vaccine. I mean, that's all I do is give vaccines all day long. I mean, I'm already registered for the Vaccine for Children program in New Jersey. We're already on the New Jersey Vaccine Registry in that program. Why do I need another program for COVID-19 vaccine? Just give me the damn vaccine, get it to my office, and we'll administer it. We'll follow the same protocols we have. But now they got to create extra hoops for me to jump over before I can get the vaccine in order to give it. And then everybody's complaining, why aren't the people getting the vaccine? Okay, so this is, cut the red tape and let the program move. Okay, next thing is you got to expedite the studies of COVID-19 vaccines in children. Right now, Moderna's vaccine is approved for 18 and older, and Pfizer's for 16 and older. Well, kids are 25% of the United States population. How the hell are you going to get 80% herd immunity if 25% of the population can't even get the vaccine because it hasn't been studied in them yet? So we've got to finish the darn studies so that this huge segment, quarter of the population of the United States, can then be eligible to even receive the vaccine. So, okay, just pointing that out. This is nothing new. I've been saying this all along. I know there are reasons for the delay. You study the vaccines first in adults and you work your way down. But we're in the middle of a pandemic. We need to reach herd immunity to get it under control. These studies should have been started much earlier, in my opinion, because it's necessary in order to be able to deliver these vaccines to everybody quickly. All right, moving on. You need to incentivize the providers, the people who are going to administer the vaccine. Why? Why can't they just volunteer their services and do it out of the goodness of their heart? Well, you could do that, but if you want to get this done in a hurry, then you make it financially feasible. You don't make them go in the hall and reach into their own pocket to pay to be able to volunteer. You make it reasonable so it's cost effective to do it. And if you make it reasonably financially feasible, this thing will happen so fast it'll make your head spin. That requires the government to provide the incentives for the people who are actually doing the administration and getting the vaccine into the arms of the public. I don't see that. It's not clear to me how that's happening. I know the government has paid for the vaccine so that the people aren't going to have to purchase vaccine, but somebody needs to pay for the administration of the vaccine. Unless you can get everybody to just volunteer their time and services to do this, which in some cases you may. But again, if you're in a hurry, and when you think of the cost to the United States, because we're semi-shut down because of this pandemic, I would think you'd want to get us out of this shutdown in a hurry. And to get us out of the shutdown in a hurry, we got to get the vaccine into the arms. And if you want to get the vaccine into the arms quickly, incentivize the structure, the administration team, for making it financially feasible for them to do that. And then it will just happen automatically. Now, even if you incentivize like healthcare providers and all this, that's not going to be enough, because even if I have the vaccine, it takes time to do it. I can only administer so many doses a day in my office. If I'm incentivized enough, I can hire additional staff and do it much faster. That would depend on the level of incentivization. But more effective are, again, using the pharmacies like they're planning to do, public health clinics, and we need to set up large vaccination centers, such as have vaccination fairs like in school gymnasiums and in municipal buildings, where you just have a huge number of people set up, providers, where you could have maybe 10, 20, 30 vaccine stations, and people just massively going through there and getting it all at once. I mean, that will go much faster than trying to schedule individual appointments in a private office. But that's not to saying we shouldn't be doing it in the individual physician offices and clinics, etc. It's just that, we've got to do it all. In any case, I just wanted to vent a little bit because, again, I'm frustrated that I see this delay in getting the vaccines in, and I'm sitting there, so, well, I'm thinking, just get the vaccine to my office and we'll do it. But again, we'll wait. Hopefully we'll catch up and things will get to where we want them to, but boy, it should happen a lot faster than what it's happening. So let's stay tuned. Thanks for watching.